Let me, first of all, recognize the ministers who are here. Honorable Minister of Nigeria, Permanent Secretary of Botswana, with amount of time with the First Lady yesterday, and all colleagues. I was staring at you as you work in this a few minutes ago. Someone said, how do you do this? I said, terribly, I'm very fortunate to be in Washington at this time, because if we had to do this, have these conversations, a series of conversations planned, it would take 3 years to go to secure a meeting and meet all the leaders in health that we've seen in just the last few years. So this is very, very, very good. So I really want to make 3 points. One is the critical, the central role that women, young girls, or what we say, adolescent girls and young women play in the overall developmental agenda. And it starts with her promotion. And I was approached that from the lens of HIV. When we see where the burden of HIV is, so let me just pause here also to recognize someone who was Mr. HIV/AIDS for close to 10 years, Michelle Sidibe. It was the torchbearer for the direction we had to fight HIV/AIDS and UNAIDS for. So a lot of the things that I was saying in the area of HIV/AIDS connect and relate to what Michelle has championed. And he and I were in Senegal just last week, meeting with President Macky Sall, and the same discussions were playing out. So when we look at, when I came on board 6 months ago, and we did a listening session across the board, talked to some of you, many of you in this room, about where we should go with that. It became very clear that where the burden of the disease is in children, adolescent girls, and young women, and key population. But let me just focus on adolescent girls and young women for 1 second. It has tremendous implication in terms of the development and economic growth of Africa. The session we had the other day with President Masise from Botswana and President Museveni, I framed the discussion of HIV/AIDS in 3 lenses. I said HIV/AIDS 20 years ago was a serious security threat. It was a serious economic threat for the continent of Africa and a serious developmental threat. And that is true because the life expectancy had dropped significantly. But if you see where we are today, the risk is that the populations that I just characterized, as adolescent girls, young women, and women as a whole, bear the big burden of the disease. The First Lady of Botswana gave some very disturbing statistics yesterday about the burden of HIV/AIDS in Botswana and dividing that out by gender, I think, up to very disproportionately, almost like 79% to 30%, which is very troubling. But I see there an opportunity. And that takes me to the second point, which is where is PEPFAR going with where do we hope to go in the next 5 years? We just released a strategy on reimagining our strategic direction in the next 5 years on the 1st of December. And essentially says that we should focus our energy where the burden is, which is the population and the state. But very importantly, look at sustaining the response through the lenses of political leadership, financial leadership, and programmatic leadership. He also speaks to partnerships, and that is where I want to expand a little bit more. Partnership more broadly. And the kind of partnership that I'm looking for in PEPFAR is recognizing what traditional partnerships have done, which is you walk into a room and see Roche, I see here a Roche colleague, you say, and I did one partnership with Roche many years ago when I was at the USCDC to advance diagnostics. But those kind of partnerships are okay. When you look at partnerships that will require that we look at development banks and say on the continent of Africa and elsewhere, the way PEPFAR operates and say, where can we build a partnership? Okay. You look at the private sector. in Africa and in the United States and say, where can you invest? And there are many opportunities that offer themselves for investment to address women's health on the continent, recognizing what I just said earlier, where the burden of the diseases and the criticality of that population. So we are looking at, I've met with the leadership of the World Bank. I will be heading to Abidjan mid-January to meet the head of the African Development Bank. I will be meeting tomorrow with the Afro-Exim Bank to say, this is not just charity, this is the investment opportunities if we look at it carefully in so many areas. So my appeal here this afternoon is really to engage with the CEOs that are here and say, look, we have an opportunity for partnership within PEPFAR underneath that pillar, which we call partnership. We call it transformative partnerships, which is not just donations, generous donations, but see that as an opportunity by doing good and doing well. I mean, and nothing says you cannot do both, doing good and doing well. Let me just end by saying that by describing a program we've supported over the years, that is we PEPFAR, USAID working closely with us, and USCDC. It's called the Dreams Initiative. That is investing in young women and adolescent girls, and who are not necessarily infected, but who are young women that you want to empower them. Dreams instead stands for determined resilience, empowerment, AIDS-free, mentorship, and safety. So over the years, I think we are reaching out 3 million young women and girls, and empowering them. I was in South Africa in August with Secretary Blinken and had the opportunity to see and interact with so many of them. It's one of those programs that is loved across the industry, and we want to be committing ourselves to maintaining that. I will be looking for new partnerships to expand and deepen the Dreams program in the countries that exist, or expand that to countries that do not have that program, because it's really, you can see how if you empower these young women, how they can produce stuff, they become entrepreneurs in the community, and clearly that puts them out of the risk from being infected with HIV. So it's an investment area that I'm putting on the table for all of us to consider, because we're putting in a lot of money ourselves, about $300 million a year in that particular program. So thank you, Claire, for saying Claire, Yuan, for she and I have a common friend called Claire. She's probably on the call. So we've been having so let me end there and say I'm looking forward to a very exciting conversation this time.